Boleh pindah ke Fiji. As of very late today, I've just received our updated data with regards to vaccination. So currently there's 580,504 Fijians, or 97.7% of adults in Fiji have received their first dose of the COVID-19 vaccine. And 372,434, or 63.5%, have stepped up for their second dose and are fully vaccinated against COVID-19. Of course, these numbers are a little bit higher than what our Prime Minister has mentioned, but as I mentioned, I just got these figures just as I was coming out of the office, so I've updated them for the public's knowledge. I would like to thank everyone who has come forward and received their first and second dose, and encourage those who are still to receive their second dose to come forward when it's due. There is simply no substitute for full protection of vaccine. Our target population to date had been eligible Fijians above the age of 18, virtually all the adults in Fiji. Today I want to discuss the next phase of our vaccine rollout, which will include our young people aged 15 to 17 years. The COVID-19 pandemic has been a tough fight for us all, and it has been especially hard on our children who have been away from school since April of this year. The pandemic had disrupted their education, their learning and development, and the necessary life and social skills that they gain by interacting with other children at school. The safest and most sustainable way to get our children back into the classroom and to keep them there is vaccines. The Ministry of Health and Medical Services and the Ministry of Education, Heritage and the Arts, we share a long history of collaboration in vaccinating children against serious diseases like measles. Now, our task is to protect young Fijians from COVID-19. Together, our ministries will begin the rollout of the Moderna COVID-19 vaccine for children aged 15 to 17 years across Fiji. We have decided to vaccinate children aged 15 to 17 years old first, as these children are mostly in secondary school, and some of them are nearing the end of their secondary education. Under the advice of the Ministry of Education, we have been told that the years 12 and years 13 also need to sit external exams to progress into higher education. Details of how this will progress will be announced later by the Ministry of Education. Also, the vaccination of those who are younger, that's the ones in the 12 to 14 year age group, we will announce that at a later date. In terms of the details of the rollout plan, through the Ministry of Education, the Moderna vaccine will be rolled out by school clusters within the 4 divisions. Schools that are close by to each other will group together to form a cluster, where their students' rolls of 15 to 17 years old can be vaccinated. The dates, clusters and venues of these schools will be announced this weekend for the rollout to begin on Monday, 20th September. Children will need to receive 2 doses of the Moderna vaccine, which is administered at a dose interval of 28 days. As parents and guardians, you will be asked to sign a consent form for children receiving this vaccine. You will also be able to register your child online before he or she receives the first dose of the Moderna vaccine. The online registration of children through the vaccine registry portal will be available from Saturday. That's this Saturday, prior to the on-site vaccination campaign beginning this coming Monday. I need to emphasize that we will not make it mandatory for children to be vaccinated. though it is clearly the best choice any young person can make for their health and the health of others. Details and dates for when the school can safely resume will also be announced later by the Permanent Secretary for Education in a statement. Insofar as Moderna and Pfizer vaccine are concerned, they are safe vaccines for children. Children within the age of 15 to 17-year-old will receive Moderna vaccine, while the younger children from 12 to 14 years will be starting to get the Pfizer COVID-19 vaccine. The rollout for Pfizer vaccine will be announced later, but the approach will be similar to that of the Moderna vaccine rollout for 15 to 17 years. Like Moderna, the Pfizer vaccine has been approved as safe and effective for children 12 years and older. Clinical trials done among thousands of children show an overwhelming outcome of safety and efficacy of COVID-19 vaccines, Moderna and Pfizer, so far approved for children. The vaccines protect children from severe illness, hospitalizations, and even death from COVID-19. I would like to assure all parents and guardians in Fiji that these vaccines are safe. They have completed all the necessary clinical trials for safety and efficacy for children aged 15 to 17. No shortcuts have been taken in granting approval for these vaccines for children, and it continues to be monitored for safety. As is normal for vaccines, some children may face mild side effects from the vaccines. However, this does not last long. Common side effects will include pain, redness, and swelling on the arm where the vaccine is administered in some cases. And in other cases, some cases you might get a headache, nausea, vomiting, and fatigue, chills, and fever. Now, if your child experiences some of these side effects after receiving the vaccination, that is actually a sign that your child's immune system is learning to fight the virus. You can treat this at home by giving your child a normal dose of paracetamol and keeping your child well hydrated and giving them a lot of rest. If your child does not have any side effect, don't worry, this does not mean that the vaccine is not working. It's just that each individual's body reacts differently to vaccines, and that is perfectly normal. The Moderna vaccine is currently being administered to children in the same age in the United Kingdom, the United States, and across the European Union and in Australia. And it has a 95% effectiveness in preventing symptomatic infection and protecting our children from severe illness, hospitalization, and death due to COVID-19. Whilst the Pfizer vaccine has a 92% protection and is being administered to children in New Zealand. We have seen how relentless the COVID-19 virus can be, with the deaths of 5 children, the youngest being 2 months old in Fiji. And that is why we have been exploring all avenues at our disposal to find vaccines that are safe and effective for children. Like any other vaccine, there is a small chance that children may become, who have been partially or fully vaccinated, can still get infected with COVID-19. There is an exceedingly rare probability of fully vaccinated persons that they can get severe COVID-19, and even less likely instances when some may die. The point is, 95% is not 100%. The protection is 95%, not 100%. In fact, no vaccine offers 100% protection. But 95% is much, much better than 0%. By far, these vaccines and their protection they offer are the best defense that we can use to keep our children safe against COVID-19. The Ministry of Health and Ministry of Education are also using all avenues available to us to ensure the safety of our children at school through the vaccination program. By enforcing COVID-safe measures, doing environmental control measures, and also we will be doing some surveillance protocols that will mean that we will have to randomly test various groups of people within each school. A team of medical and education technical persons are working to ensure that these measures are implemented based on lessons that are learned from other countries to ensure the safety of the children, of your child, as they return to school. The overall intention is to utilize the opening years or the opening year, to utilize the opening school years for year 13 and 12. So we use that as a pilot. And as we use that as a pilot, we will then be able to refine some of the strategies that are already identified in other countries so that they become more relevant to the context of Fiji. So just to get a measure of some of the measures, or just to get a taste of some of the measures that we are considering, we will want to make sure that all adults working in the school system must be vaccinated. These include teachers, management, and all other staff, including gardeners and security personnel. Anyone who comes into contact with children or who steps on the school ground must be vaccinated. There is no moral or medical justification for putting students at risk, and individuals who refuse the vaccine have no justification to be anywhere near children in school. When schools do open, masks must be worn. Non-classroom gatherings will not be permitted. And the schools have also been directed to improve ventilation and air quality by keeping windows, doors, and vents open where possible, and also employing mechanical ventilation by using fans and ducts. Where possible, we have to also consider the use of portable air cleaners in all those classrooms, especially in areas that are not as well ventilated. Breaks will be staggered to prevent gatherings. And as I mentioned before, routine symptom and temperature screening of students and staff will be occurring, and they will test all those who screen positive. We also have asymptomatic testing protocols for a select group, and that will be implemented. Also, we will have to institute what we call absentee registry protocols. Anybody who's absent, you have to call them and find out why are you absent. Make sure that there's be specific about the symptoms that is making them absent, or the reasons that make them absent. If they relate to COVID-19, they will need to be tested and traced in terms of contact tracing and the full gamut of strategies that we use for anybody who's positive. I'm asking parents and guardians to please take the time to discuss the Moderna and Pfizer vaccine with those of your children who are to receive the vaccine. Encourage them and assure them that the vaccine is safe, that it is the best protection for them against the severe effects of COVID-19. Explain how the vaccine will be rolled out and help them to understand why they are being vaccinated first amongst other school-age children in Fiji. I also urge parents to talk to your households, family and friends on the need to also get vaccinated, because this adds another layer of protection for children, particularly as they will increase their interaction with different people as they return to school. We encourage parents and households, as we said, we encourage all our parents and households to get vaccinated. We need to be aware that as more people interacting with children are vaccinated, we actually increase the protection of our children from COVID. The Ministry of Health will be working closely with the Ministry of Education, Heritage and Arts to ensure that all parents, guardians and children are well informed of the Moderna and Pfizer COVID-19 vaccine before getting vaccinated. And also they'll be well informed about the process involved in vaccination. Over the next few days and coming weeks, the Health Ministry will facilitate and host discussions online through mainstream media, inviting parents and guardians, CSOs and faith-based leaders and the public at large to discuss and receive further information about COVID-19 vaccination program for 15 to 17-year-olds and the children's vaccination in general. Dates and times for these webinars and information sessions will be shared on the ministry social media channels, the Fiji government channels, and through the media. We are also in the process of finalizing the rollout plans for vaccinating children from 12 to 14 years. And this will be announced in due course once we firm up some of our plans. Further details of the vaccination program for eligible children will be announced through the Fiji government and the Ministry of Health and Medical Services Facebook pages and the Ministry of Health and Medical Services website, and also through the media. Whilst we have a prospect of hope to vaccinate our children and to provide them with an extra layer of protection against COVID-19, I cannot reinforce enough that we must all continue to practice other COVID-safe measures if we want to see a drop in COVID-19 cases in our community. This means wearing a mask properly,
covering up when you are coughing or sneezing, washing your hands regularly with soap and water or hand sanitizer, keeping a 2-meter physical distance from others outside of your household, and avoiding crowds. Without these measures and low levels of vaccination coverage, we can expect to see COVID-19 continue to spread in our communities and affect those who are most vulnerable. We also face a big threat from an ongoing battle that we have against misinformation. We counter this by providing you honest and verifiable facts and information about what is happening on the ground with our COVID-19 response. It is a continuous battle, and we can beat this misinformation together by getting our information from credible sources. For us, that will be the Fijian government and the Ministry of Health and Medical Services Facebook and the Ministry of Health and Medical Services website. We will ensure that we provide you with information that you need to make an informed decision to vaccinate your children when the vaccine program rolls out. We look forward to your continuous support towards our vaccination programs, and we know that you will help us to protect the most vulnerable in our society. We can start by ensuring that our children receive the Moderna and later the Pfizer vaccine. Thank you.
Mula Vinaka. I thank the media for being here this evening. As the media, you play a crucial role in helping us relay timely and correct information on the rollout of this school's COVID-19 vaccination program. The Ministry of Education, Heritage and Arts is pleased to work in partnership with the Ministry of Health and Medical Services on this vital vaccination program for children aged 15 to 17 years. I wish to reiterate the message delivered by the Permanent Secretary for Health, Dr. Fong, that we are using all resources at our disposal to ensure that this program is safe, accessible, and is the best option for our children to return to school. The information on the Moderna vaccine and more details on the vaccination rollout program will be released on the Fijian government, the Ministry of Education, and the Ministry of Health Facebook pages and in the media over the next couple of days. I cannot stress enough how vitally important it is for us to get our children vaccinated so that they can return to school to further their education. As announced earlier, all school staff who interact with students will also be fully vaccinated, as the school will act as an extended bubble for the students. So I urge students within the ages of 15 to 17 years to get vaccinated for your safety and the safety of your friends when you go back to school. The 5 months of school closure has been a very difficult time for everyone. We understand that very well. We also understand that our Year 12 students need to sit exams so they can proceed to Year 13, and our Year 13 students need to sit exams so they can enter tertiary education. We appreciate the fact that students are getting a little frustrated staying at home for so long. You are not alone. Many other children around the world are in similar situations. We also want to bring you back to school. Our ministry is working closely with the Ministry of Health and Medical Services to work on the logistics so that we can safely bring our years 12 and 13 students back to school. I also want to make a plea to all the adults associated with schools and students to get vaccinated. We're all looking forward to getting some normalcy in our lives, and vaccination is the most important part of this effort. In the meantime, I hope all our students are spending some time studying, spending quality time with their parents and siblings, and of course, taking all COVID safety precautions to remain safe. Thank you.
Thank you, Shani. Anjeela from Fiji Village. Good evening. For students aged 15 to 17 and whose parents do not grant them permission to get the vaccine, what happens to them when schools do open up?
As we mentioned, the idea is not to mandate the vaccination for children, and opening of school is not predicated on mandatory vaccination for the children. What we do need to do is vaccinate all the adults 18 years and above. We also will need to have all the other measures I mentioned. Currently, we're just going to go through an exercise now with some of the senior education officials for them to carry out a audit of various schools, so that we identify all the poorly ventilated spaces that require some attention, and decide how best to use them. If they're not usable, then not to use it. So basically, you'll end up with a red tape around all the poorly ventilated spaces that we cannot use. There are also other structural changes that may need to be done in terms of creating windows, or what the other thing that we were discussing the other day was the use of vents, exhaust vents, using fans and exhaust vents to ensure that the air within the classroom is continuously moving. There are other things like indoor masking that will be made mandatory, much like that you see in the US and many of the bigger countries, where they emphasize now on indoor masking in order to create a safe zone with well ventilated space indoors and together with masking. The breaks are not going to be, we're going to stagger all the breaks just to make sure that there's not too many people gathering outside. So there's a number of measures, and there's a group of us, I think with some technical people from education and the medical team, that will form a task force that over the next, from now until the 1st of November, where we will start pulling together all these measures and ensuring that these measures will exist so that we can create a safe zone for our children when they get back to school. But as I mentioned, it's a safe zone for children who will not be mandated to be vaccinated, but will be encouraged to be vaccinated. And even after we do this initial vaccination phase, we will still offer the vaccination once the school starts. And we'll still keep offering and encouraging parents and children to be vaccinated moving forward. Yes.
Sir, ma'am, this question is for the PS education. Ma'am, given that it takes 28 days for these eligible students to receive their second dose, are you already considering when for Year 12 and 13 students to sit for their exams?
Once the students are vaccinated and when they come to school, our Year 12 and Year 13 students will go through several weeks of studies, revisions, and then they will sit exams. So we will not just bring them in and get them to sit exams, because we're very mindful while we are providing study materials, we cannot be assured that every single student has done the same work. So the whole idea of bringing them back is to spend time with them to make sure that everybody catches up and everybody is on the same page before we then get them to sit exams.
So ma'am, should we say this should be expected by earlier next year, or will it be happening sometime later this year still?
It would possibly be early next year. It really depends, because we also have to be very mindful that this is, we are going into the cyclone season. So we have to cater for all those other disruptions while we try and, get the term together.
And what about other plans for other grades? Will they progress through to the next level, or do they have to repeat again?
At this point in time, we are still looking at several options, and I believe my minister's already announced that next year we're looking at a 4-term year, and what that means is we will allow students to come in the first term and again revise and catch up on difficult concepts so they don't lose the learning that they would otherwise. Again, the same issue, we cannot guarantee that every student is doing what they're supposed to be doing. So that will allow them to all catch up on this year's work before they progress into the next year.
Thank you for that, ma'am. Dr. Fong, this question is basically from the announcement made by the Prime Minister in regards to 70% capacity for certain businesses. He had said that this should come into effect by the 4th of October. In the event 70% is achieved earlier than that day, should these businesses assume that they should immediately start operating at 70% capacity?
I think, much like the discussion, much like with the lifting of our borders, we achieved more than 60% yesterday. But we decided to sit back again, think, go through some other factors and say, before we deliberated and decided that, okay, we can open today. So I think the plan has always been that when we get to the mark that is mentioned, we start to seriously navigate that space. We preemptively sort out some plans, but we have to try and work out the implementation. And the main thing is implementation. We get plenty plans, but at the final day, the proof is in the implementation. So it will require a lot of discussion again as we're getting closer to 70% on how we can ensure that those promises are kept. They will be kept. It's just that we do at times need a bit more time and space to ensure that those timelines are maintained. Yes.
Just a last question from me. For the benefit of pub owners and bar owners, are they also included in this category?
I believe we have still maintained the concept of taverns. The tavern concept is still being maintained, and we will continue with that. There's a more detailed document that is with us, and we will slowly enumerate on what's in that document as we move forward. Yes.
Thank you, sir.